My name is Nick Leso. I graduated URI in 2015. I'm from West Warwick, Rhode Island, and I chose URI for pharmacy school because I think that it's an excellent local choice. I didn't want to go too far away. I like the idea of staying close by. All my family lives in Rhode Island, so going far away didn't really interest me. And the cost associated with URI is really a great drawing factor for someone who's in state. Once you get into the program, you really realize that the program itself is incredible. The professors who are in the program are so dedicated to the students. I wasn't a terrific student for my pharmacy school years, but I had staff and faculty who were behind me every step of the way, really driving me to succeed through all of it. And it was really, really great.
The faculty is amazing. It makes the experience so much better. What does a typical day at work look like for you?
So it usually starts off pretty hectic, catching up on filling. The courtesy refills all drop in the morning. So just kind of getting through the grunt work of the day is usually the first few hours. Pretty dedicated filling. The order comes in pretty early in the morning for us, which is really nice because I would hate waiting around for it. But for it to get there pretty early is nice. So we kind of try to get that out as quick as we can too. So no one's really waiting around for their medicine and they don't have to be. Usually we grind pretty hard until my lunch break. Walgreens now closes from 1:30 to 2 for lunch, which is the greatest development in pharmacy practice, in my personal opinion. Being closed for lunch is brilliant. It really changes the way the day goes for you. Then after lunch, I can do a little bit more clinical work. I can do the phone calls that Walgreens requires. We have access to outcomes, MTMs. So depending on the day, if I have time, I can make some MTM calls, reach out to doctors' offices and patients to work on that sort of thing. In the evening, it's more of administrative work, making a schedule, filing, things like that, that just need to get done at some point. They usually get pushed off until the very, very end of the day, or the next day if there's no time, you know?
If you were to talk to a younger pharmacy student, what would you want them to know about your job?
I think that the most important thing with community pharmacy is treating people well, having a customer base that recognizes you, respects you, and that you treat well. You get out of what you put into it. I like to tell my techs, especially, like, the advice I give my customers is the same advice I give my parents. Like if my grandmother walked into the store and asked me about something, I would tell her the same advice I told any one of my customers. We are a business, but I'm not gonna compromise a sale. I'm not gonna compromise a customer for a sale. You know what I mean? So that's my mentality on it, at least.
Yeah, that's a great way to look at it. The what you said about what I would tell a customer is the same thing I would tell my grandparents, because it's true that we want to gain their trust and we want them to, feel like they can trust us. So how do you feel like URI prepared you for this role?
I think they did an excellent job. I mean, I'm like I said earlier, I'm very, very pleased with the faculty, the staff there. And I think that I learned everything that I needed to learn to do this job well. Dr. Ward did it really directly, but you need to learn how to learn this really specific way of learning to succeed in this job. And that's something that URI did really well, was teach you how to know things that you don't yet know, and teach you the important things to know when you're looking at, say, a patient information sheet, and how to convey that information in a way that's really easy for the patient to understand, and in a way that the patient can then utilize themselves. I think that URI did a really excellent job of that.
For sure. I feel like it's all, now that I'm in my rotations, it's all kind of starting to come together in a way. Like, there's just so much information thrown at you during your didactic years, and then when you're actually doing it in practice, okay, this is how I would deal with this if I was working here as a pharmacist. Was there anything else you wanted to share that I didn't ask or you didn't talk about at all?
Community pharmacy, I think, is ultimately what you make of it. I mean, going with a good attitude every day, you gotta come out with pretty good results every day. So yeah, treat people like they matter, and they will matter. So yeah, I think that's the most important thing with community pharmacy.